say, like right now I'm quarantined with 5 other people, and let's say I have it. Do we all stay together? Do we just separate me? Like, what do we do?
So assuming that you have COVID, is that what you mean?
Correct. And nobody else, well, we don't know. Like I have symptoms and nobody else has, and I'm quarantined with 5 other people for 14 days.
Right. So, this is, again, we do the best we can here. So if you have symptoms and you're living with 5 other people, then we want you to try and we don't know if you have COVID. Let's just say we don't know. I mean, personally speaking, if it was me, I would just assume that I have it. And right. I would try to self-isolate as much as possible in my own home. So quarantine is what you do when you're not sure and you're just kind of, trying to avoid people in general. Isolation is what you do when you are sick. Okay. So actually, the Ontario Medical Association has a really good fact sheet on COVID. There's a lot of information there. There's actually instructions on how to self-isolate and how to quarantine. But essentially what you'd want to do, if possible, is to separate yourself from them as much as possible. So that means different bathroom, different bedroom, having meals prepared and delivered to you, wearing a mask if possible, cleaning surfaces, door handles, that kind of thing, until your symptoms are gone for probably 48 hours where you're symptom-free.
Okay, thank you.
You're welcome. Any more COVID questions, or do you guys want me to go on with anything else?
I have a question, Dr. Parkin.
Sure.
A friend of mine's mother is traveling back to Jamaica, and she obviously needs to self-quarantine herself, but he lives at home with his mom and his son, and they have a dog. And how should they quarantine themselves from their mom? Basically, stay apart most of the time. That's a sticky part. And how do they manage that, her coming back from her trip?
It is challenging. There's actually a lot of healthcare workers who are in the same position. So for example, they are going to work, possibly being exposed, and then having to come home and live with their family. So kind of, what do you do? At the very least, the person coming back from Jamaica does need to self-isolate for 14 days.
Okay.
In terms of how much interaction she has with her family members, again, I would say try and keep it to a minimum. I know it's difficult, but hopefully, she doesn't have it. But if she can, it's that 6-meter distance. Try to keep that between family members at all costs. And maybe for that period of time, try and use your own facilities. If
right.
possible.
It's the dog is the issue. Like, what do you do with the dog?
Well, so that's a good question. I have a dog. And the information that I don't know, I'm not a vet. So I think the worry with pets is more, can they act as vectors? Like, can they carry the virus on themselves and then possibly transmit it to people that way? Gotcha. I don't really know that we have that information. I would probably just try and avoid contact as much as possible. It's kind of do the best you can in that situation.
I want to say something here, because I was following WHO reports, and they said that dogs cannot get infected with coronavirus.
Thank you for that.
Yeah, so animals being infected is one thing, but animals, meaning like they don't get sick necessarily, but I don't think we really know yet if they can be a carrier of it. So for example, if I sneeze on my dog, can my family members then pick it up from touching the dog? And right. I think that would be more of sort of the concern in this case. I think that's what you're asking.
Okay, thank you.
You're welcome.
I got also something which was not asked here, but I think it's worth sharing. So as I've just said, I was following WHO reports, and they said that basically like this process of vanishing the virus happens after 4 months of spreading among the communities. So I think we are currently at this stage, right? Because we have a virus in the country and it's spreading among, like, between the communities, right? So I guess that should be a good estimation that we should be free from the virus within 4 months from now. What do you think about that?
Sorry, was the last part of the question, we should be free of the virus 4 months? 4 months from now? I couldn't really hear it totally clear.
Yes, at least that's what the WHO states. So they say that 4 months after starting the virus to spread among the communities, the situation will stabilize and the virus will disappear. So, I mean, disappear, like there will be less and less infections. So when you even look at the situation in China right now, like every day there's like up to 10 new cases in different provinces. Some provinces are even free from infections.
Yeah, I would love to say that we're going to be free of this virus in 4 months. I don't think that's the case at all. I think that what we can achieve is a significant flattening of the curve, which is kind of the hashtag that you're seeing a lot. So what we need to do is we need to decrease these new cases of COVID. The more that we can do that, the more time we have, or the more time scientists have, to develop treatments and vaccines. Again, a lot of this is just kind of speculation and kind of using science to sort of extrapolate and try and figure out what the possible trends are for the future. There is some concern in the medical community about things kind of coming down for a while and then seeing a rebound, for example, in the fall. So the idea is, let's try to reduce as many cases as we can right now. Give us that time so that the healthcare system isn't overburdened, and we can focus resources on developing treatments and vaccines, and then we are able to deal with new cases that arise after that.
And by the way, I think that vaccines are one of the topics that we're supposed to touch. So in order to actually start distributing the vaccine, it takes around a year from the development. So like once you create a vaccine, then you test it, and it takes around a year to start actually distributing it. Is that correct?
Sorry, Maria or Steve, can you just repeat that? I'm just getting a bit of feedback.
He was asking if the vaccine takes about a year for it to actually go through trials and then get used. Is that correct?
Yeah, I think the trajectory is somewhere between, I would say on average, probably between a year and 18 months. Obviously, companies are, going full tilt right now and trying to produce a vaccine for this. They are kind of pushing through really quick to get to clinical trials. So hopefully, we'll see one sooner rather than later. But generally speaking, yeah, I would say a year is probably a reasonable amount of time.
What do you think is the realistic amount of time before we go relatively back to normal? I know this seems like this is going to be a long period of time. Do you think this is going to be, a month, 3 months? Rough idea?
Yeah, it's a great question. I don't think anybody really has an answer to that. My personal hope, this has nothing to do with medical science or any kind of, established data. I'm hoping that by the summertime, things are settled enough that we can resume some amount of normal activity. A large part of this is the fact that because we're short on testing kits, we can only test people who are high risk. If we had the ability to test a greater number of people, what we would be able to say is, for example, we see a high number of COVID cases in this area, so we have to deal with that area. But this area seems to be okay. And then you can kind of, try and you can control it that way, but we don't have that luxury right now. So because of that, it's kind of a whole blanket approach. Everybody needs to isolate. So, I hope that in the next 3 months, at least see a flattening and not as many new cases. But only time will tell. So any other quick questions or?
Now that, again, if we're stuck in here for 3 months, what do you think people are going to need? I obviously think, I don't think it's the physical wellness. I think it's mental wellness that is going to be the biggest thing that we're going to have to focus on. What kind of things can you see or foresee that people should be trying to think about beforehand and trying to make sure that they don't get into, say, mental breakdowns or some kind of thing, like something that you think that we might be seeing due to being stuck, like the whole community being stuck in the house for 3 months, considering we're made to be social. We're social beings. We're all about community and everything like that. So I think, for me, and I get anxiety staying at home for a day. So my wife is probably going to divorce me by the end of 3 months. So it's what kind of things do you, or could you foresee, just in your opinion? It doesn't have to be medical. It's just things that we should be aware of and be like, you know what, shit, let's just take care of this and make sure that things like this don't happen, or just be hyper aware to make sure we're gonna, just take care of ourselves. And help others.
That's a real amazing question because it's a real thing. And I expect a lot of mental health issues are going to arise out of this. I'm sure that psychologists and psychiatrists are going to be, inundated with this kind of stuff as well. I think that, so number one, being outside is okay as long as you are with only the people that you live with and you are not coming into contact with other people. So you want to go for a family walk, you want to go to the park, to an open space, not a park, I should clarify. So yesterday, for example, my family went to an open space. We played with our dog. My kids were told, I told them they weren't allowed to play at the park because we don't want them touching surfaces right now. So from a mental health point of view, just getting outside and getting fresh air is okay under controlled circumstances. But I think that it's the social interaction, Chris, which you're talking about, which is really, quite important for people's mental health. Maybe, to the point where we took it for granted before and we didn't realize how much we need that social interaction to stay happy and healthy. But, there are ways to do it. Luckily we're in this, in 2020, technology is amazing. So for example, what you guys are doing with your Zoom classes, I know for me personally, that has totally saved me this week. When you wake up in the morning and all it takes me an hour to go through my posts and my updates, and it's all about, how terrible things are right now. Having that interaction where I can see faces, I'm seeing some of my, my gym friends through the TV screen. For me, that is a huge mental break. Doing things like FaceTime, staying in contact with people, picking up the phone and calling them. These are things that we have to kind of reconnect with now. We haven't done for a while because we're all really busy, but, sending texts and letters and, like everybody says, checking up on your neighbors, making phone calls, that kind of stuff. Spending family time together, movies, board games, doing things with your kids, with your, with your significant other. It's just whatever way you can, so that you still feel connected. And then obviously there's sleep and nutrition. A lot of people are concerned about being home all the time now, and I'm stressing and I'm doing this and I'm doing that. And, just be cognizant of that stuff, right? Stick to your schedule, stick to your diet regime as much as possible. And I think that if you have a daily schedule, you're less likely to just kind of do things on the fly and do things that you wouldn't normally do, snacking, that kind of stuff, which I know is difficult.
Yeah,
We've got some questions from Instagram. One of the questions was, What is the true definition of cases resolved?
Well, that's a good question, actually. That might be something I have to actually look at for you. I don't know if the cases resolved are cases that were tested positive and symptoms have resolved completely. Because as far as I know, they're not doing tests of cure, which would mean that you have to repeat the swab to make sure that you're negative. But I would have to, let me jot that down and I'll get back to you with an actual answer.
Sure. We got another question that says, how is it that South Korea has been able to test more aggressively when they have 50 million people? I'm just reading the question.
Come on, Doctor.
Yeah. That's good.
Good luck.
I don't, like I said, I'm not a COVID expert, so I'll give you whatever information I have. I don't know if they just have more kits than we did or than we do, yeah, I'm not sure. I'm not sure if that's just a matter of how many kits they have. What I do know is that we have some amazing physicians lobbying, to the government on our behalf to acquire more kits and more personal protective equipment. Dr. Warner being one of those people. In contact, also our Ontario Medical Association, trying to, ask the government to get us some more resources. So that's about all I can say on that.
What do you think is slowing down the Ontario government? Do you think it's just money, or we just need more time?
I don't know what is slowing down the Ontario government. I think that it's probably easy for me to say because I'm a family doctor. I need more masks. Order me more masks. Obviously, it's a bit more complicated at the federal level. It's a tough situation. We are just, we're trying our best to get the message out there via our Ontario Medical Association, especially to get the government to start, increasing the numbers of equipment and resources that we do have.
I got another one here. How concerned should parents be about keeping their kids safe in other ways other than COVID? For example, breaking your arm as a kid wouldn't normally be as serious, but now having to go to the hospital for that might be more of an issue.
Wrap them in bubble tape.
Right, and that's a real thing, right? I mean, these things are still going to happen, COVID or not. We're still going to have, people breaking limbs, people having heart attacks, people being diagnosed with cancer. So, so those things are going to continue to happen, and so we have to. We're gonna take precautions as much as necessary. So yes, if you have an emergency, you still have to call 911 if it's something that you need to ask for. If you have to go to the hospital, they are going to screen you. But obviously a child's broken limb has to be addressed in a hospital, or at least if it's not done at the time of the injury, you have to see a doctor. Then you will have to see a doctor. It's just going to be under a more controlled setting.
Okay, I got another one here. It says, is there a lesson in the current pandemic in the value of vaccines in general?
Yes. Thank you.
I think that was your sister, by the way.
Oh, starting to fight.
I promise. But if there's anything other than social isolation, and getting the word out, the other thing I think we really, 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 really have to learn from COVID is vaccines work and vaccines save lives. Which I was going to sort of mention, maybe this is a good segue just to kind of get away from COVID for a bit and just kind of do like a general vaccine information thing here. But when you look at the history of medicine, and I'm talking like the last several hundred thousands of years, the one medical technology that has saved more lives than anything else, so more than chemotherapy, more than stenting coronary arteries, the one thing that has saved more lives than anything else is vaccines. So yes, this is a great way to sort of, kind of just look at the picture again and see vaccines for what they are. I just wanted to actually highlight, in case I had gone to the vaccine topic, a couple of new things in vaccines that I did want to make people aware of, that you might not be aware of, because vaccines are also ever changing and always being updated. For those of you who are not aware of the new meningitis vaccine, there is a new meningitis vaccine called Bexsero, or sorry, that's one of the brand names of it, but there's a vaccine for meningococcal B. Meningococcal B is a type of bacteria that can cause meningitis, obviously very aggressive, and this vaccine has now been available probably for the last, I would say maybe 2 to 3 years, and we know that our high-risk population for meningitis are kids, especially babies under the age of 1, and then our teens and young adults because of close contact. So just to make you guys aware, it is not one of the publicly funded vaccines, but something to ask your doctors about. The other really new vaccine that you're going to hear about, especially if you're a female and you're pregnant, is getting a booster of the Adacel vaccine, which is the same as the booster that you get when you're 14 to 16 years old. We are now giving that to pregnant women in their last trimester around that time. And it's basically to provide the woman the antibodies for the whooping cough. That baby will be born with those antibodies, because we've seen whooping cough on the rise in the last few years. So that's a fairly new one you may not be aware of. And then the other one I wanted to quickly mention for people over the age of 50, or as of 50 and older, is the shingles vaccine. So there's a shingles vaccine. Again, it's not covered by the government, but definitely recommended for people over the age of 50 so that you don't get shingles. And there is a pneumonia vaccine that is recommended for people 50 and above as well. So those are kind of like newer vaccines, just to be aware
of. We got a question from someone here. It says, what precautions should be taken for someone who is due to have a baby in the next few days or weeks? Are they safe at the hospital? That's a good one.
That is a good one. So as far as prenatal care goes, a lot of physicians, again, I can't speak to exactly what the obstetricians are doing. A lot of family doctors like myself do prenatal care. So, you know, obviously if it's just a routine kind of prenatal, some of those might be postponed for a couple of weeks, which is probably okay. You know, but if you have to be seen, again, it's going to be probably under a very controlled circumstance. So we're trying to keep people in the waiting room to a minimum, get you in and out. And then you have to deliver. You have to deliver in a hospital. Well, I know not everybody delivers in a hospital, but personally speaking, you know, if you are going to have a baby, you're obviously, you know, and you're going to be in the hospital. The hospitals themselves now are being a lot more strict with who they are letting enter, including visitors.
I got no other questions at the moment.
Okay.
If there's anything you want to go ahead on.
I was just going to say for vaccines, just the 2 other ones that I wanted to quickly mention, just again, bread and butter family medicine kind of stuff, is hepatitis vaccines. So I know that I do a lot of education in my clinic with regards to vaccines. One of the ones that I do recommend is the hepatitis vaccine for hepatitis A and B. So kids in grade 7 will get their hepatitis B shots. That is covered by the government. What I like to do is offer it to my patients because you can get the hepatitis A and B vaccine together, and that can be done after the age of 1, which I recommend because a lot of kids are in daycares, and so there's potential, you know, body fluids being exchanged with biting and that kind of stuff between kids, but also for travel. So if you know, at some point the world is traveling again, it's nice to get those hepatitis A and B vaccines given to children while they're still young. And then there's the Gardasil vaccine, which is the HPV vaccine, which is now also recommended for boys. So it's now given to all kids in elementary school. So any questions about vaccines, I'm happy to answer it as well.
When you get people say like, I don't want to give my kids vaccines, and I'll feed them like organic food instead, or I'll choose to get everyone vaccinated so this way they'll keep my kids safe or whatever. Is it a specific vaccine that they're against, or is it all vaccines in general? I'm not too sure, because I do see, like, you see the social media posts like vaccines can kill you, vaccines can give your kids Down syndrome. I've seen all kinds of stuff. And what's your thought on that, Doctor?
Right. So again, this is where we really have to be careful as to what kind of information we're getting, what kind of resources we're getting them from. The Canadian Pediatric Society is a wonderful website to get good information on vaccines. So is the CDC website, the Center for Disease Control. To date, we have not only do we not think it's true, but it's actually been disputed that the main vaccine which causes sort of concern was the MMR in terms of autism. That information has been debunked. We know we have evidence, medical evidence, that says that it is not true. As far as any other associations between vaccines and illness, we have no proof to show that. What I tell my patients is this: if I'm going to give you a vaccine, we know that in general, there is going to be about 1 out of every 1,000,000 cases where I'm going to have a significant reaction. Anaphylaxis, a neurological, event like Guillain-Barré syndrome. Those are risks that occur in about 1 out of every 1,000,000 doses given. That being said, the chance that you're going to get measles, chickenpox, the flu, if we don't give these vaccines, is a lot higher. So, I know especially when the HPV vaccine came out, there was a lot of controversy about that being unsafe, causing a lot of side effects. Again, we've got years of data now showing that it is very safe, and not only safe, but very effective, meaning it reduces cervical cancer rates. So there's that piece of it. And then there was another part to your question, Chris, that I'm forgetting now. Oh, the herd immunity. Herd immunity. So that's what you're referring to when you say, well, if everybody else is vaccinating their kids, I don't have to vaccinate mine. Which, yes, when other people vaccinate their kids or themselves, you definitely get an advantage of that disease not being prevalent anymore. What starts to happen, though, is that more and more people say, well, I'm not going to vaccinate because everybody else is vaccinated. And then you see what happens, for example, in, every year when we see these measles outbreaks, right? Because people are not being vaccinated. So it doesn't last long. And at some point, when you're not vaccinating sufficient amounts of people, disease comes back.
And sorry, when you said the one that was debunked, it was the MMR vaccine. Is that, can you elaborate? Like, what is that? Like, that people were paranoid about?
So the MMR vaccine is measles, mumps, and rubella. Oh, okay. And that was the vaccine that became very controversial with regard to causing autism.
Okay. Because I know, like, for my sake, I know you hear people talk about it, but then it just went to, like, you just associated with all vaccines do that, because you just hear vaccine, and you can get, autism, whatever. So people are just scared of all vaccines just because of, I guess,
right.
They use them as like a Kleenex term, or blanket term. So it's measles, mumps, and whatever. Okay, so that's
yes, that was the one that was particularly, sort of attached to causing autism, which medical evidence has now disproven many times over. Actually, not just once.
Interesting. I got another question here from Instagram. It says, do you have any recommendations about how to manage my eczema during this time with increased hand washing and elevated stress levels?
Yeah, really good question, actually. I know how you feel, because, the hand washing is happening many times during the day. So for eczema in general, eczema is basically a condition where you lose that barrier between your, the skin barrier. So the nice protection that your skin gives you is kind of gone, and you lose a lot of moisture. So as much as possible, try to cover your hands. For example, if you're washing dishes, that kind of stuff, wear gloves. The second thing is to avoid immersion in hot water. So try to not shower with like really hot water. Try not to wash you know, if you're not washing dishes with gloves, try not to use really hot water, because the hotter the water, the more moisture you lose. In really, you know, severe cases of eczema where people are starting to feel itchy or the skin is burning or cracking, oftentimes we'll treat that with a topical steroid. Depending on how bad it is, there's different potencies of steroids, but like a hydrocortisone cream, that can be very helpful. But the biggest thing is to moisturize. So some of the moisturizers that I really like are, so Vaseline is wonderful. You can use Vaseline. It's a little bit greasy, but especially at night, it would be good to use it then. There's a really good cream called Lipikar, spelled Lipikar. So that's a really good one. There's also CeraVe, which you can buy in a big, like a tub, like fairly decent size, and just moisturize as much as you can.
I got a question, because you're listing all the very important things for eczema. I actually have eczema. Could you please enlist them under like the Facebook post or something, like things you can actually use to treat eczema?
Sorry, was that list things that you can use to treat eczema?
Yes. Like, can you write them down? That would be perfect.
Yeah, for sure. Yeah, I can give you a list. Typically speaking, eczema is treated, it's a stepwise approach. So, you know, sort of with mild eczema, it's prevention and keeping that skin barrier intact. And then after that, it's topical steroids in increasing potency, depending on how bad it is, for the shortest amount of time possible, obviously. And then, you know, we do that sort of on an as needed basis, but I'll definitely, I'll figure out how to post that to Facebook or wherever.
Doriana, it's Maria. So you can just send it to me and I'll even post it for you guys on the Christine Anthony.
Oh, that would be great.
Instagram. Just going to what you said about eczema and specific lotions. I know that both my kids have eczema. And especially my youngest, Selena, she's super sensitive. And recently, she's just getting kind of like a rash on her body because I've been bathing her more frequently. But what you said, the lotion Lipikar, amazing.
It's good, yes.
Oh my God, I use it on both of them, and you can completely tell a difference from day to day when I use it on it, because it's thick, but it's not super greasy.
Exactly.
I know sometimes when it's really bad, I'll use Vaseline, but Vaseline is super greasy, but the Lipikar is wonderful.
It is, yeah, it's really, really good. The other thing we can do for adults as well is that when you do come out of the shower or kids out of the bath, instead of taking your towel and kind of, you know, really scrubbing them dry, just kind of take the towel and pat them. So sort of pat your skin dry, leave it a little bit damp, and then that's a good time to put your moisturizer on top so that you're locking in whatever water is still on your skin.
Oh, really? That's interesting.
Yeah.
Awesome. Thank you for that. So yeah, I'll post that for you guys. Not to worry. The different lotions that you guys can use. Any other questions about eczema? Or anything else?
I got a question about vaccines. So I'm planning on going to South America once things get back to normal. And well, I wanted to get vaccinated before going there, because I know that my immune system, I mean, the stuff that I got here are different than diseases that are present in South America. So what can I do? Like, can I go to the hospital, or are there any like centers where I can get it?
That's a great question, actually. The best thing for you to do, so the question is just around what do you do for vaccines if you're going sort of somewhere that's, you know, not your, like what we're used to, like North America, that kind of thing. The best place to visit is a travel clinic. There are many, many travel clinics available. If you Google travel clinics in my area, you will find them. They are not covered by OHIP. However, they are invaluable because you will go to the travel clinic specialist, who's a doctor, will tell you exactly which vaccines you need for that area, and they stock them, so you can start the vaccination process right there usually.
Okay, thank you so much.
You're welcome.
We're about an hour in here. If you got any last questions here, guys, we're almost an hour in. So if you got any last questions, we'll take just like one or two more. For eczema creams, or the eczema creams suggested, are those fine for kids?
Yes, absolutely. They're just general moisturizers that work really well.
Okay, no more questions.
I got actually 2 questions. So first question was vaccines. How does Tori with this like anti-vaccines movement started? From what I heard, it actually started in someone there's a background noise somewhere. Anyway, so someone actually like some company that paid for fake results in terms of vaccines in order to discourage people to take them. Have you heard anything about that? Because that's what I heard it started.
Sorry, guys. Can you repeat that question? I had a hard time.
You know, I'll just write it down.
Yeah, write it in the chat is easier.
Sorry, I'm getting a bit of feedback. I just can't.
Yeah, I think somebody else was off mute and took it down there. I muted everybody. Okay, if you want to write that in the questions, we'll take that as the last question. Otherwise, we're about an hour in. Doriana, if you want to do any kind of closing remarks.
Yeah, no, I just wanted to say thank you for allowing me to just kind of give some information. I know at this time, kind of COVID took the majority of the hour, but I hope that the information I gave you was useful and relevant, helpful. But I think the main message is, so socially isolating is really important right now, but let's keep our mental health in check, reach out to people, friends and that kind of stuff, and stay, really stay mentally well and healthy. And yeah, I mean, hopefully this will kind of come to an end soon and life will resume to somewhat normal again.
Awesome. Thank you so much. I think from all of us, thank you very much. Having you talk to us, answer all of our questions. It's something that we appreciate very much. And let us know, guys. Give us some feedback if you like what you saw today, and if you love the chat, we can absolutely do more of this. It's just giving you guys as much information as possible, and getting everybody together. Social isolating, right? Just getting everyone together. Thank you so much, and it's been a great time.
Thanks, guys.
Thank you.
See you later. Bye, guys.
Bye, everybody.
Thanks, Doriana.
Thank you.
No problem. Take care, guys. Bye.
Thank you, Doriana.
Thank you. Bye.
Doriana, bye.
Bye.